Hi, my name's Dr. Marcus Spry. I run a dental practice here in the UK, and a big welcome to my YouTube channel. Hi, in this video I'd like to talk about wisdom teeth and why they can be a bit of a problem. I don't know if you've had a wisdom tooth removed, or you need to have it removed, or you're concerned about it, but today we'll get down to the details of exactly what on earth is going on with your wisdom teeth. Okay, so wisdom teeth. If we have a look at this model doesn't show a wisdom tooth, but it allows me to tell you whereabouts they would be, and they would be back in this position here. So that is the front of the mouth, and the tongue would be here, and the wisdom tooth would be the last tooth. So there's a first molar, a second molar, and then the third molar, and the third molar is the wisdom tooth. And they grow because perhaps in the past we needed more teeth to chew our food, and we had perhaps more space for them to come through. But where we've come along and our jaw shapes have changed, there sometimes just isn't the space for the wisdom tooth to come through, and they can end up growing at some quite odd angles. And I've got an X-ray here. Okay, so here is an X-ray of a patient of mine that's given me permission to show you this particular view. And this is the lower jaw here, and the observant of you will notice this funny little thing here, and that is his wisdom tooth. Paul doesn't have wisdom teeth over here. He just didn't grow with them, and he has a wisdom tooth here which has come through okay, but this one here is his spare, and it's just not going anywhere, is it? It's in the bone. It should be coming through and going through that way like that, but it clearly isn't going to go anywhere. So Mother Nature just grows them that way sometimes, and that's fine if they don't give you any trouble. We would let that lie and not bother it. But if it was causing repetitive infections, then the tooth has to be removed, and then things heal over, and then the patient is free of the risk of that repetitive infection problem. So the question is whether the wisdom tooth causes any bother. And if the wisdom tooth causes persistent bother, then it probably is best to get rid of it, to have it extracted. And that could be extracted with very effective numbing, or it can be extracted with a general anaesthetic where you're asleep completely. So it's possible to do the operation and to get through it and be okay. And then of course once the wisdom tooth's gone, you heal and everything's fine. Nobody completely knows why we have them, and there is even a theory that perhaps in the future we won't grow so many of them. Genetically they may be a difference, and we don't have wisdom teeth at all. But for the moment they do cause some patients some problems, and if that's you and it's repetitive, then perhaps you ought to consider having your wisdom tooth removed. Thank you.